Hi, my name is Sajay. I'm a consultant anesthetist at University Hospitals Birmingham and also the chair of the West Midlands division of the British Association of Physicians of Indian Origin. And I also have some other roles in the British Medical Association. In the next few minutes, I'll be quickly going through the definitions of equality, diversity, and inclusion in relation to NHS and wider healthcare. And also, as the last couple of slides, I will include some questions, the potential questions that can be asked in the medical school interviews. So what do you mean by equality? It's about creating a fairer society where everyone can participate and has the same opportunity to fulfill their potential. Equality is also backed by legislation. And there is a slight difference between equality and equity. In equality, everyone is provided the same opportunities. It doesn't mean everyone is able to achieve their potential. Whereas equity is fairer. I think in the context of employment and NHS and healthcare, I think we are talking about equity rather than equality. And why equity or equality matters in NHS? Because the NHS is an employer of the second largest employer in the world. And it includes a diverse workforce, and inclusive culture in among this workforce will improve the staff engagement, and also it will result in better patient care. And diversity is about recognizing and valuing the difference among people. I mean, there is a mosaic of people who bring a variety of backgrounds, styles, perspectives, values, beliefs, and these are all assets to the group they belong to, or the organizations they are working for. Inclusion is the complete acceptance and integration of all, regardless of their diversity or background, and this proactively leads to a sense of belonging, engagement, progression, and full participation within the organization. There's a government legislation called Equality Act 2010, which was introduced in October 2010. It incorporates previous similar legislations, and they have introduced general and specific duties for employers. And it defines different types of discrimination and also gives parity of coverage across all protected characteristics, which I will come to in the next slide. And it also gives parity of coverage across employment and provision of goods, facilities, and services. That means it also includes the patients that avail services from NHS hospitals. And it focuses on good quality outcomes rather than the actual processes. These are the protected characteristics: race, disability, sex, sexual orientation, religion and belief, gender reassignment, age, pregnancy and maternity, and marriage and civil partnership. And there is something called a public sector equality duty, which means a public authority must, in the exercise of its functions, have due regard to eliminate discrimination, harassment, and victimization, and also advance equality of opportunity among the protected characteristics. The specific equality duties means every NHS hospital should have, or NHS organization should have, equality objectives. They should also report on its progress and provide the data, and they should consider the impact of any new policies and services on the people with protected characteristics. And also they should involve and consult every member of the group or organization before starting a new service or implementing a new policy or procure services. MRAS, or Medical Workforce Race Equality Standard, is one form of collecting and demonstrating the data in terms of equality. The last MRAS report was in 2021, and it covers 11 indicators. And if you Google MRAS 2021 report, you'll get the full document, and you can go through that if you are interested in the details of all the indicators and the final conclusion. And in earlier this year, the NHS employees have come up with the first 5 areas of action following MRAS, which includes reduce disproportionality of entry into local disciplinary processes and referrals to the General Medical Council for BME doctors and IMGs, international medical graduates, and improve diversity in the senior medical leadership appointments, increase BME representation among the councils of royal colleges to proportionately reflect their memberships, and to ensure that there are meaningful local arrangements for initial and ongoing support for international medical graduates. And finally, to support these specialty and associate specialist doctors to make progress in leadership roles and by review of the contract. And I'm sure you must have heard about the NHS long-term workforce plan, which was published in the last few months. If you haven't heard, then please make sure that you go through that, because this is a hot topic currently. So basically, improving the culture of our workplaces and experience of our workforce, and to boost the staff retention to attract diverse new talent to the NHS is an integral part of the NHS long-term workforce plan. It also supports the strategic equality, diversity, and inclusion outcomes like addressing discrimination, increase accountability of all leaders, support the leveling up agenda, and make opportunity to progression equitable. Like I mentioned in the beginning, the next 2 slides are potential questions that can be asked about equality, diversity, and inclusion in the NHS. And I will share this presentation with you. And if you have any specific questions, you can contact me through Azure. And that's it from me. Thank you very much. And all the best in your interviews and with your future. Thank you.